So Barb, when I was a consultation psychiatrist, it seemed like every week I was called in to see some person, often a younger person, who had had a heart attack, and they had injected dye into the coronary arteries and found them clean. And they said, Dr. Nessie, this is a psychological problem because the coronary arteries aren't the problem, it's stress.
Right.
What do you make about that?
Right. So it's very, very true that there's been this phenomenon that cardiologists have noted for a really long time, that sometimes people, sometimes after they have acute stress, can have chest pain, and they go to the cardiac cath lab, they do an angiogram, as you said, but the arteries are wide open. There are no blockages. And how do you explain that? And of course, in the past, that's been explained in
spasm of the coronary arteries. That's what we learned back in the old days.
Right. Well, in the late 1990s, a group of Japanese cardiologists published a paper where they collected a cohort of patients that they had seen. Most of them were women who had a very traumatic and emotional experience. So they had witnessed a loved one die. They had someone had lost their life savings gambling. Someone had gotten very bad news. So intensely emotional experiences. In response to that experience, they'd had chest pain. That chest pain had brought them to an emergency room where they had an EKG. The EKG was abnormal. That took them to the cath lab for an angiogram. An angiogram was done, and the arteries around their heart were clean. That is, there were no blockages. They were not having
there was something
a heart
wrong.
attack. But the muscle, the ventricle, was abnormal in its shape.
It was kind of ballooning out, right?
Exactly. It was ballooning out.
I love the name of it, I've got to say it. Takotsubo syndrome means octopus trap, kind of a little bubble kind of thing.
Imagine that you're a Japanese cardiologist, you're in the cath lab, and you see this oddly shaped ventricle when you're doing what's called a ventriculogram. And you're trying to think of to describe it to a friend, you know? And you might say, oh, it looks like, and the word that they used to describe it was Takotsubo, because it looked like the pot that the Japanese fishermen used to capture octopus.
It's so wonderful.
So it's an octopus capture pot. So that's how it got its name, Takotsubo cardiomyopathy. It's often referred to as stress cardiomyopathy.
So my college classmate, Joel Dimmesdale, is a very well-known, psychosomatic physician and psychiatrist who really devoted much of his career to studying these kinds of stress-induced sudden death and cardiac syndromes. Right. And it's wonderful. It sounds like the physiology and the phylogeny is catching up to provide different kinds of explanation.
Well, one of the most exciting moments in my Zubiquitous journey,
I love it,
happened when I was at a veterinary conference. Katherine Bowers and I went to a veterinary conference. It was a wildlife biology and veterinary conference. And there was a conversation about capture myopathy. And I had heard the term before at the zoo, where they're very careful to not stress the animals out because there's this risk. But I started learning about certain species, particularly shorebirds, for example, who are very vulnerable to acute onset sudden death.
So you grab them and hold them, and some of them will die.
Some of them will die. Or what was described to me is that when some shorebirds, when wildlife biologists want to study them, they need to band them and do some phlebotomy. They use a cannon netting technique that involves a cannon exploding, and then the net flies out and unfurls on the birds, and it's frightening for the birds. The sound plus the sense of restraint. And that up to 10% of them can succumb to this experience. And I then learned that in other species, certain hoofed species, ungulates, it can happen. It can happen in lagomorphs and rabbit-like species. It's seen pretty much across a pretty wide range of animal taxa. And I started wondering whether, in fact, what that might be could be an animal form of Takotsubo cardiomyopathy.
Right.
And in fact, and not surprisingly, it's named something different, right? And not surprisingly, physicians were absolutely unaware of it. Because the field of veterinary and human medicine have been so completely
this has been your mission and your passion,
separate.
Is to bring it all together.
And I got really excited as a cardiologist about whether, in fact, we might be looking at the same phenomenon. Right. And if we were, how we might begin thinking comparatively, phylogenetically, in a way that could generate novel hypotheses about how to better understand Takotsubo cardiomyopathy in human patients. And that has become one of my missions. It was really an early moment where I recognized that the gap between human and veterinary medicine was not only real, that it had consequences, that the lack of bridges between the fields, the lack of communication was really depriving both fields of the kind of information that could generate novel and important hypotheses.
So one thing is trying to figure out why it's more common in some species than others, while recognizing it's really common in all. And a whole different question is why it happens more to some individuals within a species. Let's go on and talk about that in a minute.